Mr. President, last month I received a message that reminded me of just how important the work we do here is for people and families in Michigan and all across the country. Diane of Bloomfield Hills wrote to me about the cost of her prescription medicine. Diane is diabetic, and she takes 2 types of insulin or 4 injections per day. Diane's retired, she's on Medicare, and with a supplemental policy for prescriptions. Diane told me that usually when she goes to the pharmacy, she owes a copay of $650, and sometimes more, for a 3-month supply of just one of her prescriptions. But the good news is, Mr. President, not anymore. Thanks to a unified Democratic majority last year, people on Medicare now have the cost of their insulin capped at $35 a month. $35 a month for anyone who is on Medicare. Last month, Diane went to the pharmacy like usual. The pharmacist told her that her 3-month supply would now be $105 instead of $650. She says, I paid and walked away with a big smile. She added this, I know that for many seniors, the cost of insulin has been difficult or impossible to afford if they have a limited income or live on the margins. Thank you for your support of this important legislation, helping seniors and others by reducing the cost of insulin. Mr. President, this $35 cap per month on insulin is helping millions of people on Medicare breathe a little easier. And I know, because of your strong yes vote as well as mine, this is the reason we get up every day, to be able to help people, to be able to reduce costs, to be able to make sure that they can enjoy their life and actually have a life, save their life. Insulin is a serious medication. And so this was a really important accomplishment that we came together on. It was disappointing. We didn't have one Republican colleague join us in the House or the Senate, but we stood together and were able to get that done. Unfortunately, people who need insulin and aren't on Medicare are still paying outrageous prices for a medication their lives literally depend on. We tried to cap insulin costs per month for everyone. For children, we know children with juvenile diabetes, this is incredibly serious. We have families that come here to DC every year. We have a wonderful group from Michigan that comes every year to share their stories, the children sharing their stories, showing us pictures, talking about what it is for them to manage this every day, their families talking about the cost. And we tried to cap their costs at $35 a month as well. But unfortunately, because of budget rules, the Republicans were able to force that to be a 60-vote margin, and they blocked it. Shockingly to me, they blocked it. So they blocked $35 insulin cap for children. Why? Unfortunately, to protect pharma profits. I'm going to repeat that. Democrats tried to ensure that families wouldn't have to spend more than $35 a month on insulin that keeps their children alive. Republicans blocked it. It was just one more gift to an industry that's received quite a few gifts in recent years from Republicans. First, let me start with the fact that from 2010 to 2019, American taxpayers contributed more than $230 billion in research funding that helped drug companies develop new medications. I support that. I support public-private partnerships. I support public financing of research. We want that. We want new medications. But then you turn around and you look at Between 2016 and 2020, drug companies spent $577 billion on stock buybacks, 10 times more than they spent on research. 10 times more than they spent on research. And they also significantly increased executive compensation. Now, drug company CEOs can definitely support insulin for their children. We want it for all the children of America. After the Trump tax giveaway, some giant, profitable drug companies now have an effective tax rate of under 10%. Republicans lowered it for all corporations to 21%, but some of the big drug companies got even a bigger gift, below 10% for an effective tax rate. That's less than the tax rate a typical postal worker or a typical preschool teacher pays. And between 2000 and 2018, big pharmaceutical companies raked in $8.6 trillion in gross profit. Trillion dollars in profits. Here's the Cliff Notes version. Pharmaceutical companies employed 1,587 lobbyists last year, almost 16 for every senator. Almost 16 drug company lobbyists for every one senator. Then Republicans provide huge tax cuts for them and blocked legislation that would help families afford medication that keeps their children alive. It's clear whose side they are on. The wrong side, in my opinion. Diane's lucky. She's on Medicare and can afford a $35 per month copay for insulin. A lot of Michigan families aren't so lucky. Consider the Lockwoods. 3 children in the Lockwood family have type 1 diabetes and take insulin. 3 children. A change to their insurance coverage meant that the family went from paying no copay to paying $600 a month in a copay for insulin for each child. $1,800 a month in a copay for their 3 children. They couldn't afford it, Mr. President. So they began driving to Canada, not that far from Michigan, driving across the bridge to Canada where the same medication costs $71 because the Canadian government negotiates the best price for Canadians. Then the pandemic closed the border. Jim Lockwood needed to find a job with better health insurance, and he did in Ohio. American parents shouldn't be forced to either drive to Canada in order to pay for their children's prescriptions, or they shouldn't be forced to uproot their families and move to another state in order to find a job with good insurance so they can afford their children's medicine. It's time for Republicans to stop working on behalf of their wealthy buddies and join us in working on behalf of American families. Children with diabetes, people under age 65 need a $35 per month cap on their insulin, just like we have been able to do as Democrats, coming together for seniors, people on Medicare. I think that's what we should be focused on here together, and invite our Republican colleagues to join us. Thank you, Mr. President. I yield the floor.